the worst medication that weakens your leg nerves and causes neuropathy. Ever thought that a prescribed medication meant to help you could actually be wrecking the nerves in your legs? That weakness you feel, the numbness in your feet, the tingling that just won't go away, it might not just be from getting older. It could be a side effect of one of the 16 medications we're about to unveil. You'll learn how these substances work, what symptoms signal danger, and what to do if you're taking any of them. And one of them is the worst of all. A silent villain that could be causing permanent damage to your nerves, and it might be sitting on your shelf right now. Want to protect your health? Stick with me till the end. Number 16. Metronidazole. Metronidazole, known to many by its brand name Flagyl, is an extremely popular antibiotic used for intestinal, vaginal, and even dental infections. So trusted is this drug that its use has almost become routine in quick treatments. However, its therapeutic power hides a worrying side effect, especially when used in high doses or over a long period: peripheral neuropathy. Yep, this antibiotic can damage nerves, mainly affecting the legs and feet. Chronic use of metronidazole is linked to symptoms like tingling, numbness, and even persistent pain in the lower extremities. These signs, often mistaken for circulatory or postural problems, may indicate ongoing nerve damage. And the worst part, in many cases, these symptoms only appear after treatment, making it hard to link them to the medication. This allows the problem to advance silently, compromising the patient's quality of life. The mechanisms behind this effect involve metronidazole's toxicity to the peripheral nervous system. It interferes with the transmission of electrical impulses in the nerves, causing communication failures between the brain and limbs. Over time, this disruption impairs motor control and sensitivity in the legs. Although the medication has many benefits, its use should be limited to the truly necessary duration. Prolonged use without proper medical supervision significantly increases the risk of neuropathy. The good news is, in most cases, neuropathy induced by metronidazole is reversible if caught in time. Immediate discontinuation of use, along with adopting neurological support strategies like B-complex vitamins and physical therapy, can relieve symptoms. However, if exposure to the drug is too prolonged, the damage may become permanent. This reinforces the importance of always following the medical prescription strictly. Self-medication in this case can be very costly. Many patients do not associate the use of the antibiotic with neurological symptoms, so they delay seeking help. At the first sign of numbness or burning in the legs during or after using metronidazole, seek medical advice. The earlier the diagnosis, the better the chances of full recovery. Health professionals need to be alerted to investigate this type of reaction, especially in patients who frequently use the medication. Prevention depends on the right information and careful monitoring. Number 15. Nitrofurantoin. Nitrofurantoin is an old friend in the battle against urinary tract infections. Widely prescribed for its effectiveness and safety over short periods, this antibiotic has a history of use that engenders trust among both doctors and patients. However, what many do not know is that, when used repeatedly or over an extended period, it can also cause peripheral neuropathy. And once again, the nerves of the legs are primarily affected by this complication. The toxicity of nitrofurantoin on the nerves manifests in symptoms similar to those of other neurotoxic medications: numbness, burning sensation, pins and needles feelings, and weakness in the legs. The recurrence of these episodes can seriously affect the mobility and well-being of those who depend on the antibiotic frequently. The main concern is the frequency of treatments. People who suffer from recurrent urinary tract infections often receive continuous prescriptions for nitrofurantoin. This can lead to an accumulation of the substance in the body, intensifying its action on nerve tissue. The result is an increased risk of damage to peripheral nerves. And the impact goes beyond mere physical discomfort. Neuropathy can affect independence and limit simple daily activities like walking or driving. As with metronidazole, symptoms of neuropathy from nitrofurantoin tend to emerge progressively. Patients start with minor discomforts in the feet, which evolve into persistent tingling and, in more severe cases, even muscle strength loss. Therefore, it is crucial that any atypical symptoms be reported immediately to a healthcare professional. Early diagnosis allows for the discontinuation of the antibiotic and adoption of measures to preserve the nerves. It's worth noting that this complication is more common in individuals with impaired kidney function. This is because the kidneys are responsible for eliminating the medication, and when they do not function well, there is greater retention of the substance in the body. This is yet another reason for careful medical monitoring in the elderly and people with kidney issues. It can never be overstated. Even medications considered safe can be dangerous if used without control. Alternatives should be discussed with a doctor, especially if infection episodes are frequent. Number 14. Hydralazine. Hydralazine is a medication used to control high blood pressure, mainly in patients with resistant hypertension. Its mechanism of action works directly on blood vessels, relaxing their walls and facilitating blood flow. But behind this cardiovascular function hides a little discussed risk, the potential to cause peripheral neuropathy. Although rare, this adverse reaction deserves attention, particularly in prolonged treatments. Neuropathy associated with hydralazine tends to manifest in people who use the medication continuously, especially at higher doses. Symptoms, once again, appear in the legs and feet: tingling, numbness, burning sensation, and even loss of strength. These manifestations can arise slowly, being mistaken for normal signs of aging. That is why this risk needs to be widely disseminated. What makes hydralazine particularly concerning is that its potential to induce neuropathy is linked to a phenomenon known as drug-induced lupus. In this condition, the body reacts to the medication as if it were a threat, triggering an inflammatory response that can affect the nerves. This autoimmune reaction is unpredictable and, when it occurs, needs to be treated urgently. If ignored, it can cause permanent damage to nerve impulse conduction. Another point of concern is that hydralazine is often used in patients who already have other comorbidities, such as diabetes or kidney failure, which by themselves already increase the risk of neuropathy. This creates a dangerous combination, where the medication can accelerate an already ongoing process. Therefore, clinical monitoring must be constant, assessing both the effectiveness on blood pressure and possible emerging neurological signs. Despite the risk being considered rare, it is real. And the more informed the person is, the greater the chances of preventing or mitigating complications. If you are using hydralazine and start to experience neurological symptoms, see your doctor. Simple tests can detect the onset of neuropathy and guide a change in treatment if necessary. Never underestimate the signs your body gives you. They are the first alerts that something needs to be adjusted. Number 13. Phenytoin. Phenytoin, also known as Dilantin, is a well-established medication in the treatment of epilepsy, used for decades to prevent convulsive seizures. Its use is common, especially in the elderly, as it offers effective control of abnormal electrical discharges in the brain. However, chronic use of phenytoin can cause a severe and often overlooked side effect: peripheral neuropathy. This type of damage primarily affects the nerves of the legs and feet, compromising the quality of life of patients. The clinical manifestation of this neuropathy involves symptoms such as muscle weakness, imbalance, numbness, and pain in the lower limbs. Over time, patients may begin to trip frequently, have difficulty walking, or even experience intense pain at the slightest touch. These signs are often attributed to aging when, in fact, they may be caused by the continuous use of phenytoin. The confusion between natural aging symptoms and medication side effects delays diagnosis. The mechanism of damage involves phenytoin's interference in the conduction of peripheral nerve impulses. Additionally, this medication can affect the absorption of essential nutrients for nerve health, such as B-complex vitamins. The lack of these vitamins further aggravates the damage to the nerves, making the neuropathy even more pronounced. Patients on long-term use should be periodically evaluated for signs of nutritional deficiency and neurological symptoms. An additional concern is that phenytoin has a narrow therapeutic window, meaning the line between an effective dose and a toxic dose is very thin. Small variations in blood concentrations of the medication can potentiate its adverse effects. This requires constant monitoring with laboratory tests and individualized adjustments. Neglect in this monitoring can exacerbate the risk of neuropathy and other more serious complications, such as phenytoin poisoning. Despite its side effects, phenytoin remains an important therapeutic choice, provided it is used responsibly. The secret lies in constant clinical vigilance and evaluating the risks and benefits. In some cases, alternatives with a lower neurotoxic potential may be indicated. Never stop using it on your own. Any change should be made under medical guidance, safely and cautiously. Your brain needs to be protected, but so do your nerves. Number 12. Isoniazid. Isoniazid is a pillar in the treatment of tuberculosis, being an essential part of therapeutic regimens worldwide. Its potent bactericidal effect helps control one of the oldest and most resistant infections in human history. However, its continuous use requires special attention to a detail often overlooked. It can cause peripheral neuropathy by depleting vitamin B6 levels in the body. This side effect is more common than one might think. Vitamin B6 or pyridoxine is essential for the health of peripheral nerves. When its levels drop due to the action of 𝙤𝙤𝙤𝙦, the nerves begin to suffer structural and functional damage. The result is symptoms such as numbness, burning, loss of sensitivity, and even muscle weakness, particularly in the lower limbs. This complication can arise even with just a few months of treatment if there is no adequate supplementation of the vitamin. That's why every patient taking 𝙤𝙤𝙤𝙦 must, without exception, receive vitamin B6 supplementation. This simple care is sufficient to prevent most cases of neuropathy related to the medication. However, in practice, this protocol is not always strictly followed. And when the deficiency sets in, the symptoms may persist even after the end of treatment, making recovery more difficult and slow. Risk groups such as the elderly, alcoholics, and people with poor nutrition are even more susceptible to 𝙤𝙤𝙤𝙤-induced neuropathy. In these populations, the risk is elevated because their metabolism is already compromised, facilitating the depletion of pyridoxine. For these patients, the dose of vitamin B6 may need to be higher, requiring individual adjustments. Ignoring this is a clinical error with serious consequences. Therefore, if you are being treated with 𝙤𝙤𝙤𝙦 or know someone who is, make sure vitamin B6 is being supplemented. Number 11. Linezolid. Linezolid is a powerful antibiotic used to treat severe and resistant infections, such as those caused by multi-resistant bacteria, including MRSA and vancomycin-resistant 𝙤𝙤𝙤𝙣. Its use is reserved for serious cases when other antibiotics do not work. However, its efficacy comes with an important risk, the development of sensory peripheral neuropathy, especially when the treatment extends beyond 2 weeks. This type of neuropathy is characterized by a progressive loss of sensitivity in the feet and hands, which can evolve into a constant sensation of numbness and discomfort. In some cases, patients report burning pains or a sensation of electric shocks at the slightest touch. Motor impairment is not common, but sensory loss alone is enough to significantly affect quality of life. Walking, handling objects, and even writing can become difficult tasks. The direct link between the duration of treatment and the risk of neuropathy is one of the biggest challenges in the use of linezolid. The longer the use, the greater the risk of neurological toxicity. And in some patients, the damage can be irreversible. That is why experts recommend that linezolid be used for the shortest possible time, always with neurological monitoring and rigorous attention to the first signs of impairment. The exact mechanism by which linezolid affects the nerves is not yet fully understood, but it is believed to be related to its action on mitochondria, essential structures for energy production in cells, including neurons. This interference impairs nerve metabolism, leading to progressive degeneration. Ocular toxicity is also possible, with reports of optic neuritis in patients on prolonged use of the medication. To reduce risks, clinical monitoring should include regular assessment of limb sensitivity and vision. The line between antibiotic benefit and neurological damage is thin, and only careful monitoring can ensure that the balance is maintained. In many cases, immediate discontinuation of the medication at the first sign of neuropathy can reverse the symptoms. Therefore, never ignore the initial signs, even if they seem mild. Number 10. Valproic acid. Valproic acid, also known as sodium valproate, is widely used in the treatment of epilepsy, bipolar disorder, and migraines. Its versatility and efficacy have made it one of the most prescribed medications for the control of neurological disorders. However, what few know is that it can also negatively affect peripheral nerves, especially in people with carnitine deficiency, a substance essential for cellular health. Carnitine is responsible for transporting fatty acids into mitochondria, where they are converted into energy. Valproic acid interferes with this process by reducing the body's levels of carnitine, which directly compromises nerve functioning. Over time, this imbalance can cause neurological symptoms that are confused with other conditions, making diagnosis difficult. Have you ever felt your legs heavy or numb after starting treatment with valproate? The first signs of peripheral neuropathy in this context usually emerge as minor sensory changes. Tingling in the feet, a slight weakness when climbing stairs, or difficulty walking long distances can be the initial alerts. If not investigated, these symptoms can evolve into chronic pains or loss of motor function. That is why monitoring with laboratory tests and neurological evaluation is essential for those on continuous use of the medication. The risk is even greater in the elderly and people with metabolic diseases who already have reduced carnitine reserves. For these patients, supplementation of this nutrient can be an effective strategy to prevent complications. Attentive doctors request serum carnitine levels and adjust the treatment based on the findings. This personalized approach prevents the treatment of epilepsy or migraines from generating an additional neurological problem. If you or someone close to you uses valproic acid and notices changes in the legs, such as loss of strength or an electric shock sensation, seek medical evaluation. Number 9. Topiramate. Topiramate is a modern medication primarily prescribed for the control of epileptic seizures and chronic migraines. It has also been used in treatments for weight loss, which has further expanded its use in the general population. But behind its therapeutic efficacy, topiramate carries a concerning side effect: the potential to cause peripheral neurological symptoms such as numbness, tingling, and weakness in the extremities, mainly feet and hands. This side effect is called paresthesia, and it is often one of the first complaints from patients who start the treatment. Often, these symptoms appear in the first few weeks and are described as a sensation of pins and needles or electric shocks in the fingers. Although they can be transient, in some cases they persist and interfere with daily activities. The cause of these symptoms is related to changes in the electrical conduction of nerves promoted by the very mechanism of action of topiramate. Moreover, the medication can interfere with the absorption of nutrients such as potassium and bicarbonate, which further increases the risk of neurological effects. In more sensitive individuals, even low doses can provoke these discomforts, requiring adjustments in the prescription. Another important point is that topiramate can trigger rapid weight loss, which in certain cases affects the body's electrolyte balance. This change in metabolism contributes to the instability of nerve function. That is why clinical monitoring with periodic exams is essential, especially in the first months of treatment. Without this vigilance, the symptoms can go unnoticed and become more serious over time. Despite the risks, topiramate can be used safely when well monitored. Most patients can adapt to the medication over time, and the neurological symptoms tend to diminish or disappear with dose adjustment. However, it is crucial to report any discomfort to the doctor so that preventive measures can be taken. No therapeutic benefit justifies long-term nerve health compromise. Number 8. Statins. Statins are medications widely used worldwide for the control of high cholesterol. Simvastatin, atorvastatin, and rosuvastatin are familiar names to millions of people seeking to reduce the risk of cardiovascular diseases. But behind the promise of heart protection, there exists a little-discussed risk. Statins can cause neuromuscular side effects, including pain, weakness, and in some cases, peripheral neuropathy. An important alert for those who use these medications for many years. The most common symptom related to statins is muscle pain, which can appear as a vague discomfort or a sensation of heaviness in the legs. But in more severe cases, patients report loss of strength, difficulty walking, and even sensations of numbness. What few know is that these signs can be indicative of developing neuropathy, especially when there is no improvement even after ceasing physical activity. The exact mechanism of this effect is still debated, but it is believed that statins interfere with the production of energy in muscle and nerve cells. They reduce the synthesis of coenzyme Q10, a nutrient essential for good mitochondrial function. The deficiency of this coenzyme can affect peripheral nerves, impairing their ability to conduct electrical impulses. The good news is that most cases are mild and reversible. When symptoms are detected early, the doctor can adjust the dose, switch the statin, or even recommend supplementation with coenzyme Q10. These measures usually bring significant relief. The problem lies in the lack of information. Many patients think that leg pain is normal with age and do not report it to the doctor, which allows the condition to progress. People with diabetes, advanced age, or other pre-existing neurological diseases are at increased risk for statin-induced neuropathy. For these groups, monitoring needs to be even closer, with special attention to any new neurological symptoms. Clinical and laboratory exams are important allies in tracking adverse effects and ensuring that cholesterol treatment does not come at a hidden cost. In summary, statins are effective, but they are not risk-free. If you use this type of medication and feel pain or strange sensations in your legs, talk to your doctor. Number 7. Fluoroquinolones. Fluoroquinolones are potent antibiotics, widely used to treat urinary, respiratory, and digestive tract infections. Ciprofloxacin and levofloxacin are some of the best-known names in this class. Despite their rapid effectiveness and broad spectrum of action, these medications carry a serious risk. They can cause permanent damage to peripheral nerves, leading to severe cases of neuropathy. And the most worrying aspect is that the symptoms can begin during treatment, sometimes after just a few doses. The neuropathy associated with fluoroquinolones can be intense and disabling. Patients report burning pain, a sensation of needles, numbness, and muscle weakness, especially in the legs and feet. These symptoms do not always disappear after the end of treatment, making the side effect irreversible in certain cases. The reason for this toxicity lies in the affinity of fluoroquinolones for tissues with accelerated metabolism, such as nerves. They can interfere with the structure of the myelin sheath, responsible for conducting nerve impulses. Once damaged, this layer can take months to regenerate, if the process is even possible. Additionally, fluoroquinolones also affect tendons and joints, causing injuries such as tendinitis and ruptures, especially in the elderly. Because of these effects, many regulatory bodies, like the FDA in the United States, have issued warnings about the use of these substances. The current recommendation is that they be used only when there are no safer alternatives available. Simple infections, which could be treated with less aggressive antibiotics, do not justify the risk of long-lasting neurological damage. The decision to use fluoroquinolones should be cautious and always well justified by the doctor. If you're using this type of antibiotic and start to feel numbness, tingling, or inexplicable pain in your legs, seek medical help immediately. Early discontinuation of treatment can prevent more serious injuries. Number 6. Thalidomide. Thalidomide is a medication surrounded by controversy since its creation. In the 1950s and 60s, it became notorious for causing severe birth defects when used by pregnant women. After decades off the market, it has been reintroduced for very specific contexts, such as treating leprosy and certain autoimmune diseases and cancers. But even at therapeutic doses and under medical supervision, thalidomide carries a very high risk of causing severe peripheral neuropathy, with often irreversible damage. The type of neuropathy caused by thalidomide is predominantly sensory. This means that the symptoms focus on loss of sensitivity, numbness, burning pain, and tingling in the hands, and especially the feet. In many cases, these symptoms intensify over time, even if the medication dose remains the same. The problem is that thalidomide directly interferes with the functioning of sensory neurons. It compromises axons, long structures that transmit impulses, and the myelin sheath, responsible for protecting the nerves. When damaged, these components have a low capacity for regeneration. Therefore, thalidomide-induced neuropathy tends to be progressive and difficult to reverse, especially when the diagnosis is delayed or the use of the medication extends for long periods. The risk of neuropathy is so high that the use of thalidomide requires strict neurological monitoring protocols. Monthly evaluations of sensitivity and muscle strength are mandatory, in addition to the immediate suspension of treatment at the first sign of neurological damage. Yet in many cases, the symptoms appear silently and are only noticed when the damage is already established. This makes prevention a real challenge. Despite everything, thalidomide continues to be used because in certain diseases, it offers benefits that outweigh the risks, especially in leprosy, where it can alleviate severe inflammatory lesions. But the patient must be fully informed about the dangers and closely monitored. Number 5. Disulfiram. Disulfiram is a medication used to help people who want to stop drinking. It works by creating an extremely unpleasant reaction to alcohol consumption, with symptoms such as nausea, vomiting, headache, and palpitations. This shock causes the patient to associate drinking with negative consequences, aiding in abstinence. However, chronic use or high doses of this medication can cause a concerning side effect, peripheral neuropathy, which particularly affects the nerves of the legs. This neuropathy can start subtly, with tingling and slight loss of sensitivity in the feet. Over time, it can evolve into intense pain, burning, and muscle weakness. In some cases, the patient may have difficulty walking or balancing, which deeply compromises their mobility and independence. And the most severe aspect is that these symptoms are often confused with effects of alcoholism itself, which delays the correct diagnosis. The mechanism of damage lies in the direct toxicity of disulfiram on peripheral nerves. It interferes with the metabolism of certain compounds essential for neurological functioning, such as copper and zinc, impairing the transmission of nerve impulses. This effect is cumulative and can be exacerbated if the patient already has a predisposition to neurological diseases or a prolonged history of alcohol abuse, which by itself already damages the nerves. Another risk factor is that disulfiram is often used without proper clinical monitoring. In recovering patients, the focus tends to be on controlling abstinence, not on adverse effects. This allows the neuropathy to advance silently, compromising the treatment and quality of life. The ideal scenario is that the use of disulfiram is always monitored with clinical exams and periodic neurological evaluation. In cases of neuropathy detected early, the suspension of the medication can bring significant improvement. The adoption of supportive measures such as supplementation with B-complex vitamins and physical therapy also aids in recovery. But in more advanced situations, the damage can be irreversible. Therefore, the timing of the response is crucial. Attention to early signs can be decisive. Therefore, if you know someone undergoing treatment with disulfiram who has started experiencing leg pains, difficulties walking, or sensations of numbness, it is essential to seek medical guidance. Protecting the nerves is part of the recovery process. Number 4. Colchicine. Colchicine is a traditional medication used in the treatment of gout, an inflammatory condition caused by the accumulation of uric acid crystals in the joints. It is also used in cases of familial Mediterranean fever and other rare inflammatory diseases. Despite its proven efficacy, especially in reducing pain and inflammation, colchicine carries a silent risk. It can cause neuromuscular toxicity and peripheral neuropathy, particularly in people with renal insufficiency. The toxic action of colchicine on nerves and muscles intensifies when the kidneys cannot adequately eliminate the medication. The accumulation of the substance in the body can result in symptoms such as progressive muscle weakness, loss of reflexes, pain, and tingling in the legs. The combination of muscle toxicity and nerve injury makes recovery more difficult, severely affecting the patient's mobility and autonomy. Another complicating factor is that colchicine has a narrow therapeutic margin, meaning the difference between an effective dose and a toxic dose is small. This means that even minor variations in use, especially without medical supervision, can lead to serious side effects. Self-medication, common among people who already live with recurrent gout crises, further increases the risk of neurological complications. The toxicity of colchicine can cause not only sensory neuropathy, but also motor damage. This means that in addition to pain and numbness, the patient may experience real difficulties in moving. Climbing stairs, getting up from a chair, or even holding objects can become challenging. In severe cases, prolonged rehabilitation and even the use of assistive devices for walking may be necessary. Therefore, patients who use colchicine, especially those with a history of kidney problems, should be closely monitored. Tests of kidney function and periodic neuromuscular evaluation are essential to detect early signs of toxicity. Dose reduction or substitution for other anti-inflammatory drugs may be necessary when the first symptoms appear. Do not wait to lose mobility to act. Number 3. Levomethadone. Levomethadone is a derivative of methadone used in replacement programs for opioid dependence, as well as prescribed for intense chronic pain. Being a purer and more active version, it has been gaining space in some treatment protocols. However, prolonged or poorly monitored use of this substance can cause sensory changes in the nervous system, resulting in symptoms of peripheral neuropathy. These changes involve sensations such as numbness, tingling, loss of sensitivity, and even burning sensations in the extremities, especially in the legs. Although less frequent than with other medications mentioned, these effects should be taken seriously, as prolonged use of levomethadone is often associated with patients who have a history of multiple comorbidities who already have weakened nerves. Levomethadone acts directly on the opioid receptors of the central nervous system, modulating pain. However, chronic use can affect the functioning of peripheral nerves, whether through direct interference in the conduction of impulses or through metabolic effects. There is also the possibility that the medication may mask symptoms of neuropathy that are already developing, delaying diagnosis and compromising recovery. Another concerning point is that levomethadone, being used in long-term treatments, requires individualized dosing and frequent clinical monitoring. The absence of strict monitoring protocols can leave the patient exposed to neurological risk without realizing it. This is even more critical when treatment is conducted outside specialized centers, where knowledge about less common side effects is limited. The neurological health of patients using levomethadone should be assessed with tests of sensitivity and muscle strength, as well as questionnaires about changes in body perception. Introducing neuroprotective supplements and adjusting doses are strategies that can reduce risks. But it is essential that the patient report any changes in their sensitivity or mobility to ensure a quick clinical response. Although levomethadone provides significant pain relief and is a useful tool in recovery from dependence, it is necessary to be aware of its less discussed adverse effects. Sensory neuropathy, although rare, can become debilitating. Number 2. Phenytoin. We have already talked about phenytoin earlier in this script, but it is important to emphasize. In addition to it, the entire class of hydantoins, which includes medications like mefenitoin and ethosuximide, can severely affect peripheral nerves with continuous use. These anticonvulsants are effective in controlling epileptic seizures, but over time, they become a silent threat to the integrity of the nerves in the legs, causing progressive and persistent symptoms. The neuropathy associated with hydantoins emerges gradually. Initially, the patient may feel only a slight tingling in the toes. Then numbness spreads, strength decreases, and difficulties in maintaining balance arise. In more advanced cases, there are impairments in walking and even the need for support to walk. These effects are exacerbated with age, as the metabolism of the medication becomes slower in the elderly, increasing its concentration in the blood. These drugs interfere not only with nerve conduction but also with the absorption of nutrients essential for neurological health. The lack of folic acid and B-complex vitamins, especially B12, further aggravates nerve degeneration. And as these effects are cumulative, prolonged use without specific monitoring can cause irreversible damage. Despite their adverse effects, many patients continue to use these medications for long periods without proper dosage reviews or evaluation of therapeutic alternatives. This is partly due to fear of destabilizing seizure control. But today, there are other options available with less neurotoxic potential. Discussing this possibility with a neurologist can be the first step to protecting nerve health. The best strategy is active monitoring. This includes regular laboratory exams, evaluation of serum levels of the medication, tests of sensitivity, and reflexes. Introducing specific vitamins and supplements can also help mitigate the negative impacts. Small preventive actions can prevent major functional losses in the future. And if necessary, changes in treatment should be made with professional guidance, never on your own. Number 1. 𝙤𝙤𝙤𝙤. 𝙤𝙤𝙤𝙤 is a first-generation antipsychotic, historically used in the treatment of schizophrenia and other psychiatric disorders. Although its use has decreased with the arrival of more modern medications, it still appears in isolated prescriptions, especially when newer treatments are not effective. And despite being less known today, it carries a risk that cannot be ignored. It can cause peripheral neuropathy, significantly affecting the nerves of the legs. Symptoms associated with the use of 𝙤𝙤𝙤𝙤 include numbness, tingling, and in some cases, loss of reflexes in the lower extremities. These signs often emerge progressively and are frequently underestimated, especially in elderly patients or those with mental disorders who may have difficulty clearly communicating what they are feeling. The toxicity of 𝙤𝙤𝙤𝙤 is multifactorial. Besides directly affecting the nerves, it can produce side effects on the heart, liver, and central nervous system. The sum of these impacts compromises nerve conduction, leading to symptoms that can evolve rapidly if not identified and treated. And because it is a psychiatric action medication, neurological effects are often confused with exacerbations of the mental condition, further delaying the correct diagnosis. Another important aspect is that 𝙤𝙤𝙤𝙤 can also affect vision, causing pigmentation in the retina and impairing visual perception. When combined with loss of sensitivity in the feet and legs, the risk of falls increases dramatically. In people with a history of depression or severe anxiety, this combination can result in a cycle of isolation and progressive functional decline. That is why the use of this medication requires highly specialized clinical monitoring. Despite the risks, 𝙤𝙤𝙤𝙤 can still be useful in specific cases. When used in controlled doses, under strict monitoring, and for a limited time, it can offer benefits. But it is essential that any sign of neuropathy be reported immediately to the responsible doctor. Early discontinuation can prevent permanent damage. Old medications should not be synonymous with absolute safety. Each organism reacts differently. And be aware, because all the medications I just mentioned in this video should be used under medical guidance. Never self-medicate. Likewise, if one of the medications mentioned was prescribed to you, do not stop taking it without consulting your doctor first. Your trusted doctor's opinion takes priority. And if you want to keep receiving the best videos for your health, subscribe to the channel, because it exists for one reason: to make you a healthier person with more quality of life. Helping you is my mission. In the video now appearing on your screen, I reveal 5 foods that destroy the brains of the elderly. Click on the screen and check it out. So, see you in the next video.